The reason being, as mentioned already, there are lots of growth factors, platelet-derived growth factors, transforming vascular endothelial epidermal growth factors. So all of these help promote new vessel formation, angiogenesis, mitogenesis, macrophages get activated, new vessels are formed. Eventually, there's regulation of the inflammatory process, and the new epidermis and subdermal layers also get rejuvenated. Uh, so there are a few studies which talk about PRP in the treatment of female sexual dysfunction. So this was a small study where 11 females were studied for dyspareunia, and PRP injection was given around the anterior vaginal wall and around the clitoral opening. Certain scaling and evaluation was done, and the results showed that more than half of the patients had some degree of improvement. But interestingly, 2 patients, that is 18%, had worsening of symptoms. Worsening in the sense they had hyperarousal. So again, probably this is because of the injection of the PRP, there is new vessel formation. Even the glands can proliferate, which is the Skene's glands, and clitoral area could possibly enhance sexual responsiveness by increasing blood flow. So this is the reason why there was hyperarousal in those 2 cases. But this is again temporary, and within 2 weeks, those side effects settle down. I'll just skip this slide. Now, medically, I would strongly recommend that we focus the use of PRP and regenerative medicine in conditions such as lichen sclerosis. This is a condition which is sometimes autoimmune, as such it is idiopathic, where there is a lot of atrophy of the vaginal tissue. So you can see that the opening, the introitus is stenosed. Clinically, they'll have a lot of tightening, they'll have dyspareunia, a lot of distressing symptoms. It's similar to scleroderma. And you can see that there's a lot of atrophic porcelain-like skin. If you look at these, there are areas of hemorrhagic necrosis. There is approximation of the vaginal tissues. The labia minora is getting sclerosed. Agglutination has happened. So over here again, the skin has largely atrophied. It's almost depigmented. Areas of hemorrhage and necrosis are also there. Introital opening is quite small, and there's hardly any demarcation between the majora and minora. And it's also affecting the rectal areas, perineum area as well. Now, in such cases, injection of PRP actually has been found to be very effective, and it has helped reverse some of the sclerotic changes which has happened. So I would personally feel that in such cases, PRP is an excellent medicine for rejuvenation and is a good medical indication for using PRP. Many lasers have been tried in rejuvenation, fractional CO2, erbium YAG laser. The mechanism is that it's going to stimulate collagen, elastin contraction, new collagen formation. And all of this improves the vaginal mucosa proliferation, and also helps to restore the elasticity and hydration of the lower genital tract. Advantages, it's quick as such, it's an OPD procedure, patient can go back to work. Mild discomfort, some really don't even need topical anesthesia. It's a quick 20-minute procedure, and regular activities can be resumed quite early. It's not an invasive, not like the reconstructive surgeries. Again, there are concerns with lasers, and that is there are sometimes tissue damage, especially if you use fractional CO2s, or if the settings are inaccurate, you will have remodeling or inflammatory changes more than expected, and this can sometimes even worsen urogenital pain, dyspareunia. And also because we are working around sensitive structures and organs such as rectum, urethra, bladder, so we have to be really careful when we do all these procedures. Just quite quickly. So, yeah. So in menopause, one of, again, a very problematic thing is vulvovaginal atrophy. This is because of estrogen deficiency. And sometimes after malignancies, after chemotherapy, radiotherapy also, we get vulvovaginal atrophy. And these are the patients who actually need our help the most in terms of vaginal rejuvenation and different methods which we can apply. So all these patients who complain of vaginal dryness, burning pruritus, dyspareunia, they may be, in the absence of a clinical diagnosis, it will help if we try to help vaginal rejuvenation and use of fractional CO2 laser. a few issues we need to address, and that is a lot of people also come who are not diagnosed, who are actually who have body dysmorphic disorder. So before we do any of these procedures, if somebody is highly concerned, abnormally concerned, or preoccupied excessively about the appearance of the external genitalia, it is important to rule out conditions, psychiatric conditions such as body dysmorphic disorder, because the association is actually underdiagnosed. And many individuals do not acknowledge that there's a psychiatric origin. And that's why they keep seeking multiple interventions or even cosmetic surgeries. So that is why psychological and sexological counseling is proposed to all women, because one, it helps to find out who has been undiagnosed, and on the other hand, we also need to address some of the issues that may be happening, such as a couple's interpersonal relationship as well. So that is why we need a multidisciplinary and ethical approach to female genital cosmetic surgeries or any cosmetic procedures. One interesting study which was done in Saudi Arabia. So this study asked medical professionals and health professionals what was their opinion for the performance of vulvovaginal aesthetics performance. And interestingly, a lot of people didn't find it justified. They found certain procedures justified on medical grounds. For example, vaginal atrophy using lasers or certain whitening procedures were fairly acceptable to people. But procedures such as hymenoplasty, even on medical grounds, was deemed unacceptable. Now, interestingly, when they were asked their ethical consideration, a lot of procedures were actually considered as non-acceptable by the medical health professionals. I leave you with one question, and that is slightly controversial question. That is, who is supposed to tackle vaginal rejuvenation cases? So dermatologists will say that they have the most experience and expertise with lasers and energy-based devices, whereas specialists in gynecology will say that they have advanced knowledge of vaginal anatomy, tissue structure, function. But the solution is we need a collaborative effort from everywhere. It's a multidisciplinary, ethical approach is needed. Ultimately, our aim is proper care of our patients. So to conclude, I would like to say that evidence-based recommendations are actually scarce, not much. No clear guidance also, as far as vaginal rejuvenation is concerned. And very few studies actually address the concerns of perimenopausal women. This is the most important subset of women which we are not targeting or addressing. And the decision to opt for different techniques of vaginal tightening should be taken very carefully, decision-making approach. And ethical aspects, moral considerations are important key factors before embarking in procedures purely for cosmetic reasons alone. So we must not encourage something that is to be done only and only for cosmetic reasons, and we should try to address the other issues. Thank you so much.
Very nice, Dr. Mansak. And the fact is that this is a too vaginal presentation from a too dermatological person. And the same question you raised, that who should deal with all these problems. And yes, but let me tell you here, few things which have arrived like ultrasound, laparoscopy, this cosmetology, this cosmetic gynecology, they all are actually out of our MD, MS syllabus. So even a dermatologist doesn't study all these lasers and other things in her or his MD dermatology courses,
Yeah.
And the same is happening with us also, gynecologists. We are not studying all these things. We are gaining this kind of knowledge in our day-to-day practice and in some training institutes and other things. So it's really a collaborative approach, and a dermatologist should be well versed with the epithelium, the mucosal epithelium and everything, and the genital parts and anatomy is too much belongs to the gynecologist itself. So I always, in every lecture of mine, and as you also have emphasized, that it's a teamed approach. Cosmetology as well as cosmetic gynecology itself is a teamed approach. Not only a dermatologist and a cosmetic and a gynecologist, a psychiatrist, a psychologist, a urogynecologist. There should be everyone, and the patient should be properly screened out, and whomsoever it should be referred or maybe
Yes. Absolutely, ma'am.
Yeah. Thank you very much.
Thank you, ma'am.
Thank you so much, Dr. Mansak, for the enlightening talk. Thank you. And thank you for coming today to deliver this lecture, because she was really busy. She was conducting a workshop at AIMS Procedural Dermatology. She's just running, and she has not had a lunch also. Thank you, Mansak. The lunch is ready for you. I would like Dr. Akhil sir to please felicitate Dr. Mansak. And then after that, please felicitate our chairpersons, Dr. Poonam ma'am and Dr. Alka ma'am also. Thank you.
Now I request Dr. Nishi and Dr. Akhil to kindly felicitate Dr. Alka Patnaik ma'am and Dr. Poonam ma'am to please kindly join in the process. Dr. Poonam ma'am, please. Dr. Alka ma'am has come very long way from Mumbai. So now I'll be announcing our next session, which will be a moot clinic. So moot clinic is like moot court. Have you all heard about moot court? Moot court is a dummy court where there is a judge, there is a lawyer, they discuss a case. So now we are going to present a moot clinic. So moot clinic of a sexology setup, like a patient is coming to your sexual OPD. As many of you, some of you are psychiatrists, you must be knowing how to tackle with the counseling part. But some of you have never dealt with these kind of cases, these kind of things. So our own renowned psychiatrist, Dr. Akhil, would be playing a role of a doctor. Obviously, he is a doctor. He is only doing this in the mood clinic for the first time. And I'll be playing the part of a patient who is suffering from a psychosexual disorder. And we'll be portraying in front of you what can be the approach, the best approach to deal with such kind of patients. Because I have seen so many people are afraid of, going through a patient of sexual disorder just because they don't know how to approach. They are afraid that how should I talk to such patient? How will I discuss the sexual life? How will I discuss the sexual dysfunction? So this is the thing which we are now going to showcase. I hope you learn a lot. And if there are any questions or queries, we can take up at the end of the mood clinic. So be patient, be vigilant, and be observant. Kindly see what we are doing, and after the session is over, we can discuss all the things which we are going to talk right now. Thank you very much, and I request kindly switch off your mobiles or put them in the silent mode, because you will observe it with the full zeal and vigor, then only you will enjoy it. Thank you.
Hello.
Hello. डॉक्टर साहब नमस्कार, मेरा नाम नमन कुमार है।
बताइए नमन जी।
डॉक्टर साहब मैंने आपके बारे में बहुत सुना था। बिल्कुल, मैंने सुना है कि आप काफ़ी अच्छा इलाज करते हैं, बहुत सारी चीज़ों को देखते हैं।
बिल्कुल।
और मेरी ना बहुत बड़ी समस्या हो गई है, घर में बहुत समस्या है, मैं किसी को बता भी नहीं पा रहा हूँ। डॉक्टर साहब मुझे मेरे एक मित्र ने बताया आपके बारे में
जी,
आप मेरी मदद करिए डॉक्टर साहब।
बिल्कुल नमन जी। सबसे पहले तो इम्पोर्टेंट जो है, आप आराम से रिलैक्स होकर बैठिए। जितना रिलैक्स होकर बैठेंगे उतना हम अच्छे से बात कर पाएंगे। सेकंड, आप मुझे एज ए फ्रेंड समझिए, एज ए डॉक्टर समझिए, जैसा भी आपको ठीक लगता है। आप इस बात को समझिए कि जो बात आप और हम कर रहे हैं वो इस चैम्बर के बाहर नहीं जाने वाली है, ना आपकी पत्नी को पता चलने वाली, ना किसी दोस्तों को। तो जो भी बात है वो खुलकर कहिए, कॉन्फिडेंस से कहिए। जितना अच्छे से आप बात करेंगे मैं उतनी ज़्यादा आपकी हेल्प कर पाऊँगा। पहले कुछ 2-3 चीज़ें पूछूंगा आपके बारे में। नमन जी, आपकी उम्र कितनी है?
डॉक्टर साहब मेरी उम्र 42 साल है।
42 साल है। शादी को कितने साल हो गए आपके?
सर मेरी शादी को लगभग 12 साल हो गए हैं।
12 साल हो गए। बच्चे कितने हैं आपके?
2 बच्चे हैं सर।
छोटा बच्चा कितने साल का है?
सर 6 साल का।
6 साल का है। अच्छा, क्या काम करते हैं आप?
सर मेरा किराने का दुकान है, किराने का काम करता
किराने का टाइम, तो आपकी दुकान का टाइम कितना रहता है?
साहब कोई टाइम तो होता नहीं है, सुबह 5 बजे निकल जाते हैं क्योंकि दूध का काम भी
ओहो,
है।
हाँ।
तो 5 बजे जाते हैं, उसके बाद दोपहर को सर वहीं पे खाना खाते हैं और उसके बाद रात को सर गल्ला बढ़ा के 8, साढ़े 8, 9 बजे तक आ जाते हैं।
9 बजे तक पहुंच जाते हैं आप आराम से?
हाँ सर, 9 बजे तक आ जाते हैं।
बहुत बढ़िया। और आपकी वाइफ जो है वो हाउस वाइफ है या वो भी कुछ सहयोग करती हैं काम में?
सर वो घर में ही रहती हैं।
वो घर में रहती है, बहुत अच्छी बात है। बताइए तो क्या समस्या है, मैं आपकी कैसे मदद कर सकता हूँ?
सर पहले तो सब कुछ ठीक था, लेकिन पिछले 4-5 साल से इतनी समस्या आ रही है सर, मतलब आप समझ ही सकते हैं मैं क्या कहना चाह रहा हूँ। मतलब बिल्कुल इच्छा करती है कि जैसे कि ना, मैं बिल्कुल वाइफ के पास जाने का मन ही नहीं करता। मैं जब भी सोचता हूँ मुझे इतना इतना बुरा लगता है, इतनी हीन भावना आती है, मैं बिल्कुल वाइफ के पास नहीं जा पाता। और अगर मैं जाता भी हूँ तो मतलब मुझे शर्मिंदगी उठानी पड़ती है हर बार।
अच्छा, क्या होता है, मतलब तैयार ही नहीं हो पाता है या तैयार होने से पहले डिस्चार्ज हो जाता है?
डॉक्टर साहब 90% टाइम तो तैयार ही नहीं हो पाता। अगर कभी गलती से मान लीजिए हो भी गया तो बिल्कुल सोचने से पहले ही खत्म हो जाता है।
ओके। अच्छा, जैसे आपने कहा कि शादी को तो आपके लगभग 12 साल हो गए हैं, तो क्या प्रॉब्लम सिर्फ 5 साल से, इस 5 साल से पहले की जो आपकी सेक्स लाइफ थी, क्या वो बिल्कुल अच्छी थी?
डॉक्टर साहब शुरू में तो सब ठीक था, फिर उसके बाद में कुछ दिन तक मैं थोड़ा काम धंधे में बिजी हो गया तो मैं ज़्यादा ध्यान दे नहीं पाया। उसके बाद में फिर कभी कभी दिक्कत आती थी, लेकिन उतनी दिक्कत नहीं थी। कभी कभी ठीक हो जाता था, महीना में 1 आध बार 2 बार अपना पास जाते थे। लेकिन इधर पिछले 4-5 साल से तो डॉक्टर साहब महीनों हो जाते हैं, 2-2, 3-3 महीने में पास जाने का बिल्कुल मन नहीं करता, और जब भी जाते हैं हर बार डॉक्टर साहब शर्मिंदगी होती है।
पहली बार जब ये आपको प्रॉब्लम हुई तो वाइफ के साथ ही हुई या वाइफ के अलावा भी कभी किसी के साथ आपके संबंध रहे हैं?
डॉक्टर साहब शादी के बाद तो वाइफ के अलावा किसी से संबंध नहीं हुए।
ठीक है।
शादी से पहले थे, लेकिन वो तो बहुत पुरानी बात हो गई।
जो घर में आप